So I heard about the Clark Fellowship in a CPD event, and it sounded fascinating, and it was exactly what I was looking for, a protected time for a very busy clinical doctor. And I was always interested in doing research and always interested in trauma and adverse childhood experiences, and it gave me the opportunity to do research during this fellowship. So I would definitely say choose your supervisor and plan your research very well in advance, even before you apply for the fellowship. Concentrate on writing a good proposal, because this proposal is going to help you all the year. You can always go back to the proposal and change it and amend it, but actually this is the starting point of your research. So my research project focused on identification of adverse childhood experiences and trauma by mental health professionals. It appears that mental health professionals in general not always feel comfortable to ask about trauma and adverse childhood experiences. And during this project, we try to identify the barriers and why do mental health professionals don't always feel comfortable about that, and try to understand the bigger picture, how to make it easier to identify. The more I spoke about the research, the more people were more enthusiastic and interested to identify very early childhood adversity and trauma. I think through this project we can implement methods and technique on better identification of adverse childhood experiences, and possibly train clinicians on better inquiry about trauma and general approach to trauma by clinicians. Early identification of trauma is crucial in order to prevent mental health difficulties and physical health difficulties. Personally, this fellowship has improved my skills as a communicator, both with staff and clients and parents and families. It made me realize that it is okay to ask difficult questions in a comfortable way. Also, it made me much more aware of the importance of using questionnaires and structured approach when assessing new patients. Since the fellowship, I started using structured questionnaires of adverse childhood experiences in every new patient, and we actually identify much earlier trauma than we used to. The support of the fellowship team was absolutely wonderful. It was a delightful experience to be a fellow, coming to the monthly meetings with the fellowships and to the lectures was very helpful and supportive. I felt part of the team. The action learning sets were particularly helpful, and it enabled me to be reflective about my project and also about career development in general. And honestly, it helped a lot to my self-esteem, because I never thought I would be able to conduct such positive and fruitful research, and it made me realize that I can do that, and the results of the research were amazing, and we're going to publish them in a journal, and it was really rewarding year. I'm very glad I did that.